Doctors are noticing a wave of children with symptoms of hand, foot, and mouth disease who are also testing positive for COVID-19.
CTV's health reporter Pauline Chan has the details.
Dr. Dina Kulik has noticed a flood of children coming in with symptoms of hand, foot, and mouth disease for a few weeks now.
And I also started noticing that many of their parents or family members were getting tested and they were positive for COVID at the same time. So I started asking my families, the kids who were having hand, foot, and mouth disease symptoms, to also test for COVID. And it turns out that all of them are also COVID positive.
2-year-old Finn Hughes went through the same thing a year ago.
As the rash kind of progressed through the week, there were smaller blotches kind of on both sides of the cheek. And we noticed that it just changed through the week. So it would become a little bit more red or the size would change.
Finn and his parents recovered fully from COVID-19 in a couple of weeks. Hand, foot, and mouth disease is a common childhood illness caused by the Coxsackie virus. It's characterized by fever, sore throat, blister-like lesions on the tongue, a red rash on the palms and soles of the feet or buttocks, and in babies it can appear as irritability.
We saw over 100 yesterday at our clinic alone.
While hand, foot, and mouth disease is usually a mild illness, Dr. Kulik fears that parents and doctors may be dismissing these symptoms and potentially allowing COVID to spread.
My concern is if this isn't actually Coxsackie, if this isn't actually hand, foot, and mouth disease, but rather it's COVID, and we're telling families, don't worry, it's not COVID, it's just this other virus that is so common in childhood, and they return to daycare and school or the workplace, they haven't had that 5 days of isolation or longer.
As pediatricians don't really test for the Coxsackie virus, it's impossible to say if these cases are showing a new symptom of COVID that just appears like hand, foot, and mouth disease, or if there's a connection between the two illnesses. Pauline Chan, CTV News.